Hi, I'm Dr. Kim McCoy coming at you from San Francisco, California in my little quasi-nightmare before Christmas quarantine zone. As a chiropractor, it's been challenging to figure out how I could work from home, especially since I do a lot of what's called muscle testing in my practice, which definitely needs to be done face to face. But fortunately, I've learned some new methods of indicator testing, which is a way that people can check in with their own bodies and get helpful feedback. And using the indicator testing tools, we've been able to do some pretty effective distant visits via FaceTime, Zoom, and all that good stuff. So in addition to using indicator testing as a telemedicine tool, it's also a great skill to know just for yourself, because you're able to get some good feedback from your body, which can help steer you in various directions, especially when it comes to things like what should I be eating, what supplements may or may not be helpful for me. So we're going to demonstrate that for you here today. So muscle testing is basically a low-tech version of biofeedback. It's just a way of gauging how is your body responding to a certain stimulus. So in the office, a lot of times we use an arm, we use a deltoid test. There's some people who do some self-muscle testing where they use the little O-ring finger thing, or the tiny violin finger rubby thing. I find those to be really challenging for myself, and certainly for beginners. I think with those kind of methods, it's easy to unconsciously steer the results in a certain way. So for muscle testing, to get an accurate feedback, I think it's more helpful to use muscles that are less easy to control like that. So the main tool we're going to go over today is how to use the breath as an indicator or as a self-muscle test. So what you do is you just breathe, take a few deep breaths, and just check in with yourself and see what that normal breath feels like. And that'll give you a sense of what your neutral or your baseline is. So then you want to get a sense for what your positive, affirmative, positive, neutral type of breath would feel like. So in that case, you either say out loud or think a simple affirmative kind of statement. Something real simple would be like your name. So I would say or think, my name is Kim, and then I would take a deep breath. And I'm just checking in to see what that feels like. So once you have a sense of that, then you would switch to something that's definitely not your name, that you would be non-congruent with. So I may say something like, my name is Rumpelstiltskin, and then I take a breath. And for me, what I notice when I say something that is non-congruent is it's harder for me to get that full breath in. It's kind of a shallow breath. It stops. So for some people, they notice it in the breath. Some people notice it as like a tightening somewhere in their chest. I encourage you to just check back and forth. Start with that neutral, my name is, and then what your name actually is. My name is Kim. And then something that's not your name. My name is Rumpelstiltskin. And just check in with that. So the way we use this in the remote sessions is, for example, we establish the neutral breath and then the tighter breath, and we use that in the same way that we would use the muscle test in the office. So if you're able to tell the difference between that neutral deep breath versus the shorter, the restricted breath, then you would be a good candidate for the remote type of visits, because we would use that to gauge where do we go in the treatment, what points are we holding, did we get the correction or not. It goes slower than in the office because you have to wait for full breaths, but it's a powerful tool. So how would you use this for yourself? So when muscle testing or indicating for supplements, the best way to do it is to put it in your mouth. You can also just hold the bottle up to your chest or up to your throat area. You can get results that way. You're going to get the most powerful response, the most dramatic response, by putting it actually in your mouth. So I'm going to check this one called Glucobalance. So this is a supplement that's kind of like a multivitamin for people with blood sugar issues, and that is one of my issues. So I'm just gonna take one of these Glucobalance capsules, I'm gonna put it in my mouth, and I'm gonna breathe and see what the breath feels like. And I could have just swallowed that. So in my case with the Glucobalance, I got a pretty good deep breath there. So that means that my body would probably be pretty happy if I took the Glucobalance. It means it would probably be helpful for me. So I'm going to check a couple of others. It's always good to be taking some sort of good omega-3 type oil. So I have a couple that I take sometimes. One of them is called black currant seed oil, which is really good for liver. And then there's linen B6, which is basically flaxseed supplement. So if I'm not sure, do I need one or both, we would do the indicator testing. You usually don't need multiple different omegas, but anyway, start with the black currant seed oil. I'm gonna go ahead and put one in my mouth. And I got a pretty good deep breath on that one. We're gonna check out the linen B6. And I got a deep breath on both of those, but I got a deeper breath with the Linum B6. So what that tells me is that at this time, the Linum B6, or the flaxseed oil, is actually gonna be more helpful for my body. So what I'm probably gonna do today then is I'll take the Linum B6, but not the black currant seed oil. The black currant seed oil probably would have tested stronger if I had, if there was more going on with my liver today, maybe if I had been doing some drinking the other night, things like that. So, the quarantine days can be a little depressing. So this supplement, the soybean lecithin, is one that has really helped me in the past with depression. I don't take it all the time, but I thought, well, maybe that would be a good one for right about now. So I'm going to go ahead and take one or put one in my mouth. And actually with the soybean lecithin, I get a really shallow breath. So, my brain might say, or my conscious mind might say, sounds like a good idea to be taking that right now, but my body is saying, not so much. So using that indicator testing, I'm going to not take the soybean lecithin. So today I'll be taking my Glucobalance and the Linum B6. You can do the same thing with foods. So I do drink coffee, and in spite of my Asian heritage, I do add dairy creamer to my coffee because it's so good. But let's see, what does my body think about that? So here's my coffee creamer, and I'm not gonna put it in my mouth because it'll be a little bit messy on the camera, but I'm just gonna hold it up here, and I'm gonna check in with that breath. So again, I get that real shallow upper kind of breath going with this. So the coffee creamer is delicious, but my body is not into it. So I probably shouldn't be drinking that. Sad. So anyway, if you're really interested in maximizing your body's efficiency, then I strongly recommend leaning towards the foods, supplements, substances that your body feels congruent with. So again, the muscle test is not, it's not magic, it's not a lie detector, it's not a Ouija board, magic crystal ball. It may seem magic, but it's not magic. So don't use it to try and figure out things like who will be my next boyfriend, or should I play the lottery? It doesn't work like that. But it can give you clues about where your body would prefer to head towards versus where it would prefer not to head towards. Another pretty simple self-indicator testing you can use is actually the swallow. So instead of checking in with the deep breath, you can say, or you can say a thing, hold a substance, and then check in with the swallow. So if you say, start something like your name, my name is Kim, and you take a swallow, see what that normal swallow feels like, and then you do the non-congruent thing. My name is Frank. And then oftentimes it'll be harder to swallow. There'll be like a catching. So the swallow test is real simple to do if you need to just check one or two things real quick, but the swallowing can get real old if you're checking a bunch of things. So in that regard, the breath is the preferred method. So I hope that was helpful for you, and stay safe, everybody. Hope we get through the crazy times, and in the meantime, I say just, you know, embrace the absurdity. As you can see, I'm determined to come out of this as my own evil twin. I'm growing a parallel universe evil twin beard, and why not? All right. Stay safe, take care of yourself, and be excellent to each other.